Hello, my name is Willem de Haan, and I'm a neurologist and head of the EEG lab of the Alzheimer Center in Amsterdam in the Netherlands. And here we perform central reading and analysis for multi-center pharmacological trials. Today I would like to present the EEG results of the phase 2 AscenD-LB trial with the oral p38 alpha kinase inhibitor neflamapimod. Recently, clinical improvements from this study were reported, and to see if changes in brain activity and function can reflect these improvements, we believe that EEG, as a widely used and accessible clinical tool, is the most suitable technique. We already know that the EEG usually shows severe slowing in early phase DLB, but can it also show meaningful short-term treatment effects? I would like to state that I have no relevant conflict of interest for this presentation. To start off with some background information on the second slide, in earlier preclinical studies, neflamapimod has been shown to improve several markers of basal forebrain cholinergic function, main site of DLB-related neurodegeneration. And in the recent AscenD-LB trial, improvements were seen in a DLB-specific cognitive test set, which included attention and executive function tests, as well as in motor function. You see the results of the DLB-specific neuropsychological test battery on the right here. And one presumed mechanism of action of these clinical improvements is a better synaptic function and thus better signal transmission. By using EEG, we want to see if this is reflected in enhancement of oscillatory markers, such as spectral power, but perhaps even more relevant in functional connectivity markers. On slide 3 you can see the study design. All patients who were already receiving cholinesterase inhibitor treatment before the study start were randomized to either neflamapimod twice a day, 3 times a day or placebo for 16 weeks. A routine, task-free EEG was performed at baseline and at the end of treatment. Unfortunately, due to COVID, only a third, namely 29 out of the initial 91 patients, had the follow-up end-of-treatment EEG, which has, of course, greatly influenced the power of this study. For the remaining dataset, we calculated common spectral power measures such as relative power and peak frequency, as well as the so-called corrected amplitude envelope correlation, or AECC, a functional connectivity measure that in a large recent AD trial has shown to be capable of showing short-term neurophysiological improvement. On the next slide you see the result of the spectral power analysis. You see a range of box plots for the most relevant frequency bands as well as for the theta-alpha ratio and the peak frequency. Looking at the mean relative power in the most relevant frequency bands, the power analysis did not yield any spectacular changes. The global higher alpha band did show a significant decrease, and this was actually stronger in the temporal region, which is not shown here, but these results did not survive the multiple comparison correction. However, on the next slide you can see the results for the functional connectivity analysis, and here we did find an interesting result. Overall, a consistent and dose-dependent trend towards improved beta band connectivity was found in the treated group. The AECC was most prominent in the frontal region and in the lower beta range, for which you see the results in the graph on the right. On the right you see the lower beta connectivity for all EEG regions, laid out from left to right, indicating a consistent increase in the treated group, and this was significant also after FDR-corrected permutation t-testing. So why do we find this particular change so interesting? Well, in general, the beta band is associated with movement as well as with cognitive performance, like attention and executive function, and it has also been reported as a relatively strong differentiator with AD. So, although the power of this study is limited, this is exactly the type of change that we would like to see. Unfortunately, at this moment, I cannot yet give you any correlations between the clinical and the EEG improvements. So we come to the conclusion on the last slide. Neflamapimod 40 mg 3 times a day appears to improve beta band EEG functional connectivity in mild to moderate DLB. No notable effects on spectral power have been found. But given the earlier reported relevance of beta band connectivity for DLB, we do think that this observed EEG improvement is potentially linked to the clinical improvement. It is in line with our expectations, and it provides support for further investigation in a larger follow-up trial. Thank you very much for your attention, and please contact us for any questions you may have.